Hi everyone, my name's Julia Yee with First Team Real Estate, and today I have the pleasure of speaking with Dr. Shawn Miller from Miller Orthodontics. Welcome.
Hey, thanks, Julia. I'm happy to be here. Excited to be here.
Thank you for being my guest of honor. It's a really huge privilege just to, ask a couple questions.
For sure.
Not to mention you're my number one favorite orthodontist. You
Uh,
have my smile.
Thank you. Thank you. You're our number one fan, Julia.
Oh, thank you. Yeah, I love your staff, how warm and welcoming every office is. Can you share your two offices that you have?
Yeah, so I have two locations. One's in Orange, near Old Town Orange, and one is in Aliso Viejo, in the Aliso Viejo Shopping Center.
Yes, I love both of them. It's so convenient, it's clean, and I just feel so at home. I would like to jump into one of our first questions. So, how did you get started in your journey to becoming an expert orthodontist?
Well, first you have to become a dentist. So that was my first goal. I decided pretty early on. I was in high school. I decided I wanted to be a dentist. A lot of that was just from my own experience with my personal dentist. He was a great guy, and I shadowed him a little bit. I thought he was a great businessman, a great doctor, a great, very personal person. So he kind of steered me towards dentistry. And then, so I did pre-medicine, pre-dental studies in undergraduate, then went to dental school. And then while in dental school, that's when you kind of decide if you want to be a regular dentist, general dentist, or if you want to specialize. And right from the onset, I knew I wanted to specialize. So it was just a matter of choosing which. And then there's a few to choose from. There's oral surgery, which is wisdom teeth and implants. There's endodontist, which is root canals. There's periodontist, gum surgeon, and then orthodontist. So we get to dabble and get to experience a little bit of all of them. And then I chose orthodontics as kind of what I thought would be the best fit for me and what I found to be the most exciting and challenging and rewarding. So.
That's amazing. Thank you so much for sharing that. You're really good at what you do, and I'm just so excited because my experience with you was painless. I went to the office. It was exciting. I love your warm staff, and it was just a joy from beginning to end. So another question I have is, what surprised you most when owning a business?
I don't know if anything surprised me too much. I think after dental school, I went to my orthodontic residency program at Harvard University. And there they did a really good job of training us to be orthodontists, of course, but they also gave us some business courses and some business skills to deal with. And then there's a few professors that I kind of chose as mentors, if you will, and they helped educate me and explain to me what I was getting myself into exactly. Because when you graduate, you have kind of two choices. You can go and work for somebody else or work for a large corporation or work for a small private clinic. Or you can choose to be your own boss and open your own clinic or purchase a retiring doctor's practice. And from the beginning, I really wanted to be my own boss. So I really wanted to get into the business aspect. And I knew I would either start a practice or buy a practice. So I did a lot of my homework, I guess, on the subject. So I knew it was going to be a lot of work. I knew it was going to be challenging because not only are you the doctor in charge of all the treatment and you're in charge of creating great smiles and making all the treatment flow properly, but there's a lot of other things you have to be very good at, of course. You're the HR person, you're in charge of the website and marketing and hiring and firing and
Yeah.
and then a lot of things that you've never even experienced, like signing leases and all these things like that. So
Yes.
it was a lot to learn, but I enjoyed it, and I enjoy being in charge and being my own boss and making decisions. Not all decisions are the right decision, and you learn from your mistakes and you grow and you learn how to manage people better as you go on through your practice. And then it's always just like in school where I had mentors, it's always important to still have mentors even when you are out in private practice. So I have some colleagues of mine that are a few years older than me, and they've been through everything I've been through. And whenever I have a question, we bounce things off each other. They give me good ideas and good insight of what I should be doing and what I should be looking for and focusing on. So Yeah.
That's so amazing. And I just think it's incredible, everything you do. I know you're an expert.
Thank you. Thank you.
Yeah. Okay. Describe your favorite thing about what you do.
For me, and why I chose orthodontics was every case is unique. So every patient comes in, and it's not the same thing with every patient. Every patient is a puzzle, basically, and you have to figure it out. You have to figure out how to improve that patient's smile, how you're going to align the teeth, and then most importantly, how to make it fit together and the teeth fit together properly. So
Mhm.
not every two mouths are different. No mouths are the same. So
Mhm.
um, and patients, sometimes they want different treatments. Sometimes they want Invisalign, or they want braces, or they want inside lingual braces, hidden braces, and it's up to me to kind of figure out. It's a challenge sometimes to figure out how to achieve the results that I want and they want, and make
Yes.
everyone happy. But it's part of the what's rewarding is that challenge of making everything work and everything fit. So yeah.
Perfect. Well, you actually answered my next question. I was going to ask you, what kind of options do you
Oh yes. So lots of
offer?
options. Traditionally orthodontics was for teenagers and kids mostly, but when Invisalign started about 20 years ago, a lot more adults started to get treatment. So things have changed a lot in the last 10, 15 years. So our practice now, although it's still 75% kids, there's 25%, 30% adults. And we even have adults into their 60s or 70s getting treatment. Um, so a lot of kids still get braces, but we do have the metal braces, and they can also choose clear braces, ceramic braces.
Clear.
And if they want inside braces,
Mhm.
which are on the inside hidden braces, we have some teenagers doing that. And then a lot of adults do Invisalign. That's their main choice. Typically, they want something that doesn't show, something that's easy to wear. They don't
Mhm.
really want to have braces, so to speak. So they usually do the Invisalign, or sometimes inside braces,
Mhm.
sometimes ceramic clear braces. But Invisalign or aligner treatment is getting more popular every year. It seems like we're getting more and
Mhm.
more cases and requests for that. So um, 10 years ago, we maybe did 5% of our cases were Invisalign. And
Mhm.
then every couple of years, it goes up 5%. So we're probably 30% Invisalign at this point, which is different. It was something we weren't taught much in school. So
Mhm.
we've had to learn over the last 10 years or so, taking CE courses and master courses to figure out how to treat properly without braces, because that's what we're trained to do, is use braces. So it's different, but it's a lot of technology. And I love technology and computers and stuff. So it's something that I enjoy doing for sure.
Thank you. Yes. Um, what are your goals over the next year?
So goals last year was tough, obviously, because of COVID-19. So last year was one of the toughest years in practice. Um, Back in 2011, I
Mhm.
had a fire at my office. I don't know if you knew about that, Julia, but
Oh,
yeah, my main office in Orange had a really big
oh,
fire and it burned down. So that was my biggest challenge that year. Was we had to build a new office and go through insurance, and
oh, yeah.
homeless for about 9 months. So that was tough.
Oh,
So I guess that prepared me for COVID-19 year, because 2020 was such an odd year.
yeah.
We were forced to shut down for 6, 7 weeks, and then when we got back, we had all new protocols and new systems and new safety measures and new
Yes.
equipment. So last year was a challenge. So last year was just all about maintaining the business and trying to keep patients happy, keep the patient flow going, making
Mhm.
sure everybody's being seen, because we had gone 2 months without seeing all of our patients. And so this year, I don't want to say we're looking to expand or grow or anything. We just want to kind of get back on track, really, and get back to a
Mhm.
normal practice routine and normal patient flow and normalcy. It'd be nice to get back to normal for sure in so many ways.
Yes, I agree.
Um, and being covered in PPP, PPE head to toe is
Best
fun to
practice.
work in. Yeah, so it'd be nice to be able to kind of get rid of some of that stuff as well. So.
Do you do some virtual consultations as well?
So during that 6 or 7 weeks off, it was you always have to look at the silver lining. So during that time, I had a lot of spare time for once in my life. I had 6 weeks off besides taking care of my kids during the day, but
Mhm.
I could work on a lot of systems and improve things. So we started to go like all digital for almost everything. We started to do
Yes.
DocuSign for documents, and we did a new website, which just got released. We started to do dental monitoring, which is a new technology where patients in aligners or Invisalign, they can scan their teeth from home with their
Oh,
iPhone on an app. So every week they scan their teeth, and we check their scans every week. We make sure they're wearing them, make sure the trays fit, make sure the teeth are moving, and then they don't have to come in for a visit. So it's basically a weekly virtual visit with a scan.
mm-hmm.
And then those patients only need to come see us in person every 4 months or so, which is nice. So that's really exciting technology, yeah. And then we do on our website, we have new patients can upload pictures of their teeth, and then I can give them a virtual consult, give them a virtual kind of my recommendations, and give them an estimate of what the financial cost would be without ever coming to the office. We still do want to see them in person to confirm our diagnosis and bottom line everything, but at least without ever coming to the office, they can get a good idea of what orthodontics could do for them and the cost. And that's been really popular. Surprisingly, sometimes we'll have 3 or 5 patients per day send pictures of their teeth and want to know, which is pretty exciting. Yeah.
That's amazing. That's good.
Yeah. That's good.
Well, thank you for making everybody smile so beautiful.
You're welcome. We try.
Yeah. Okay. Anything exciting going on that customers should know about?
Yeah, I mean, that's where I think it's just all about technology with the dental monitoring and the consults, which is called the Smile Snap. And then we're adding some new technology. We have the inside braces, which are kind of new, the in brace, the hidden braces, which is all custom braces. Everything in our office is digital now. This year, during that downtime, I decided to buy a 3D printer. So now we can print our own models and print our own retainers.
Oh, wow.
So we, a couple of years ago, we stopped doing the impressions, the goopy impression stuff, and we started scanning patients. But we weren't able to print those scans. But now we can actually print them in our office, which is really cool.
Yeah.
So now, someone, if they want a retainer, we can scan their teeth, print retainer in like an hour, and they can have a retainer in an hour, which is crazy. Before we used to have to send it to a lab and wait a week, but now we can have a retainer ready in an hour, which is really neat. So
I love the quality of retainers too. I actually wear them every night.
Yes, yeah, they've gotten a lot better for sure.
Yeah,
and the 3D printing is way more accurate. So the old way with the impression, and then we'd make that putty impression and make a stone model, and then but all those steps were good, but there was errors in each of those steps. So the scanner has no errors, and then the printer is just amazing. It can print such there's no errors, so they fit perfectly now. They fit even better than they did before. So
yeah, I love that. It's just so perfect what you're doing, and you make the experience better.
So the next thing we might do, which I haven't started yet, is custom braces. So right now, all the braces are the same, and I work on the braces. I design the smile, but now the newest thing is where they can print 3D braces that are custom for every tooth in a patient's mouth. So because sometimes everyone's teeth are a little different, so you can set up the case on the computer in 3D, and you can look at the final result, and then they just build the braces to make that final result, which is really amazing technology. So that will probably be starting this year.
Nice.
Cool. So the idea is better results and then faster, more efficient results. Everything's just planned out from the beginning. So,
so what's the best way to get a hold of you, Dr. Miller?
Well, our website is great. A lot of information. I put a lot of time in the website to make it very informative. So there's a lot of sections you can read all about any type of braces or any kind of procedures that we do, appliances that we have. So on there, if you want to do a virtual consult, you can upload pictures from your phone or from your computer and send in virtual images for a new patient, or you can just call us and do a traditional appointment where we come into the office, we take pictures and do a consultation. So and you can reach us out. Our phone number is on the website, of course, and we have email on the website, and you can text us to that number too. So.
Okay, amazing. I just want to ask you, did you have fun today?
Of course. Not as nerve-wracking as I thought.
Yeah, I loved it. I think it's So excited to have you on here. So looking forward to today.
Yes, yes, it's good working with a pro. So, like yourself.
Yes. Well, thank you so much for being my special guest. If you know anyone that's interested in being interviewed, or if any other small businesses, would like to be featured, please feel free to reach me anytime. And I look forward to, hearing more about you, and what's going on with your business, Dr. Miller. And
Thank you.
thank you so much.
For
And
sure.
yeah, I hope you all have a great rest of your day, and I hope have a great rest of your day too, and look forward to coming in.
For sure. Thank you. Thank you, Julia.
Thank
Yeah, as you
you.
know,
Mhm.
we share the office with the pedodontist there. So
Uh-huh.
I'm sure she'd be great. I'm sure she would love to do an interview as well about
I,
pediatric dentistry for
it
Aliso.
would be an honor and
Yeah.
a pleasure, and I'm so excited. Anyone who's curious about the best orthodontist in Southern California is Dr. Shawn L.
Oh, thanks.
You just make it easy from beginning to end, and it's just so delightful when you go in. You're not scared, and the end outcome is a beautiful, shiny white smile. Yeah. So thanks again.
All right, bye. Thank you.
Bye.